My name is Lydia Brown. I am the program director for Turn Up Knox. What we have accomplished so far, we have done innovative collaborative programming for mental health and violence prevention through building a relationship with the Mental Health Association of Tennessee, as well as building a relationship with Drums Up, Guns Down for programming that we are gearing towards the community.
My name is Rose Patterson. I'm the Treatment Access Bank Director with the Mental Health Association of East Tennessee. So a little bit about what the Mental Health Association does here in Knoxville. We offer different programming, services, and education as well. So a little bit about the philosophy of MHA. We believe in a before stage 4 approach, so a prevention first approach to mental health. So trying to increase mental health literacy and education so that people are aware of mental health, mental illnesses, crisis management. And one of the ways we do that is by working with county and city government for data reporting. So last year, we completed a mental health report for Knox County that basically just described the state of mental health, which demonstrated a huge increase in demand for mental health services, especially after the COVID-19 pandemic. We went from 1 in 5 adults experiencing mental illness to 2 in 5 adults. So the demand for mental health services increased dramatically, but the number of providers, if anything, slightly decreased. So one of the ways we decided to combat that was by starting my program, which is the Treatment Access Bank. We partner with diverse therapists in and around Knoxville to serve marginalized populations, especially those who are asset limited and income constrained, but employed at the same time. So they may have insurance, they may have access to mental health care, but they don't have the resources to cover the costs associated with therapy, or they don't have behavioral health coverage. They don't have insurance altogether, but they don't qualify for other traditional services. So we're trying to really fill the gaps. Mental Health Association also has a screening program called Screen Now. It encourages people to use our anonymous screening tool to screen for different mental illnesses. So things like anxiety, depression, ADHD, PTSD, different mental illnesses, and 80% of our users screen positive. About 1,500 people or more use that every single month. So that program has been a real success. It's really important, especially in some of these marginalized communities, to have access to resources like that. So it can actually point out if something is going on and if they need to seek further help. And then going along with the before stage 4 approach, MHAT has a mental health 101 program. So we serve schools all across Knoxville and East Tennessee. It reached over 34,000 students last year. And that way we can introduce mental health to young adults. We do have a presence in pretty much all of the high schools and middle schools within the city of Knoxville. And the goal of that is to improve mental health literacy among youth and introduce them to resources and different tools for maintaining their own mental health and also what to do in a mental health crisis. So we try to do a real wraparound approach and partner with people in the community, organizations like Turn Up Knox, to provide these services to people in need.
So we have our partnership with Drums Up, Guns Down. And Drums Up, Guns Down is a local nonprofit organization that was designed to help stop the cycles of gun violence in our communities in Knoxville, Tennessee. The program was conceived by Obayana Ajanaku following the deaths of 3 students who were killed by gunfire in East Knoxville. All 3 students attended Austin East Magnet High School, and their deaths happened within a 3-week period. One of the students who was killed was a student of Mr. Ajanaku. One afternoon following the deaths, Obayana noticed the best friend of one of the deceased students in a room by himself playing the drums with all he had in him. He was attempting to release his emotion and pain. At that moment, the idea of Drums Up, Guns Down was birthed. Obayana is a West African drum instructor, and he teaches West African drum at Austin East High School.
Turn Up Knox is a violence interruption program We strive to interrupt the different cycles of gun violence in the Knoxville area, not only with our youth, but Knoxville community members in general. We do that by providing resources that we hope in return that will, support and empower community members in order to create a healthier, safer community.
So in creating the safe spaces for youth and alternatives to prevent gun violence, we have worked in partnerships with the YWCA. Turn Up Knox has a mentoring program where we go into the YWCA Monday, Wednesdays, and Fridays, the Boys and Girls Club on Tuesdays and Thursdays. We have an emphasis on our mental health and wellness because we see that growing need with the youth. And we also will provide safe spaces for, youth in one-on-one situations as well.
That we've decided to take in regards to providing safe spaces for our young people to tap into their mental health. During spring break, we've hosted a power session with a number of young men, giving them a safe and creative environment to express some of the mental health concerns they did have. Partly hearing back from our youth, most of it was communication, being able to communicate, knowing how to communicate in these safe spaces to tap into some of the mental wellness and mental issues that they do face every day. We look forward to continuing creating these safe spaces. Consistency is one of the issues that we do have in our community. And so shifting that culture into having a consistent criteria and creating consistent spaces for our youth to be able to tap into their mental wellness.
Another part of our programming was in partnership with Drums Up, Guns Down, as well as Shade Tree Therapy. We created a Healing Through Learning Together program, which was an 8-week program that was geared towards caregivers or parents and their youth. Our youngest participant was 14. So we had 6 different families that participated in the program. And again, it was an 8-week program. We infused instruction by our therapists, 2 different therapists. We also did, different therapeutic activities to help break down that communication struggle between the caregiver, parent, and their youth. So during that 8 weeks, we did West African drumming. We did West African dance, as well as gardening, art, and creative writing. And through those therapeutic activities that were led through through different community stakeholders, we help teach the families how to communicate effectively and respectfully, and also identify where they were at on a SUD scale. So in the beginning of the beginning of each session, we were able to have each one of the families identify where they were on the SUD scale. So it was between 1 and 10. So if they had an elevated level on the SUD scale, we used the West African drumming to, help us level out. And then we started the instruction with the therapeutic activities. We had 83% graduation rate from our program, and we plan on continuing this programming as well because we had such great feedback from the community.
So a little bit about trying to combat the stigma, not just in marginalized communities, but just the Knoxville community as a whole, was the Mental Health Association kicked off different Mental Health Monday media campaigns, as well as trying to maintain a great presence in Knoxville media. So we reached over 55,000 people in 2021 through different news stories, conferences, events, outreach. We just really wanted to try to not only bring awareness to the Mental Health Association and the work we're doing, but also why mental health is important to begin with, that there are resources available like free anonymous screening tools that we have, and that people should actually care about mental health and their mental health to maintain, since we all have. So a little bit about how we hope to keep up and sustain the increase in mental health literacy. especially in our marginalized communities, is through different partnerships as well as advocacy activities that the Mental Health Association is doing, as well as Turn Up Knox. So the Mental Health Association, we work with different partners like the United Way, Knox County Schools to get those mental health 101 programs up and running. And then we also work with a number of different behavioral health care facilities. So we have partnerships with people like McNabb and Cherokee to refer people to them, as well as our city government as well. Then we do actively do a little bit of lobbying with the legislators to try to get more funding into different mental health programs in Tennessee, as well as have them prioritize mental health in their legislation. So whenever we were dealing with transitions in the mental health care system in Tennessee, we wanted to make sure that we had resources available for people losing TennCare, which we're about to go through the same thing with re-enrollment of TennCare. So we work very closely with different legislators to try to make the mental health care systems more well-funded, I guess. And so with the different behavioral health centers and private practitioners, so like in my program, we work with people from Covenant Counseling, the Middle Path, Ride the Wave, different behavioral health centers to serve a greater community, especially if people are looking for therapists that look like them. And so
With the Knoxville's Office of Community Safety, LaKeniel Middlebrook has been able to, her and myself have been able to create a partnership within ourselves to maintain a lot of the self-sustainability that we do need for our programming. Part of that goes into providing mental health resources, providing mental health sessions and outsourcing those sessions for our youth and for our community members.
Important parts of building up this better culture of mental health is tracking and evaluating our programming that we're doing, especially collaboratively. So how many people are actually completing different programs like the Healing Through Learning Together, or completing therapy sessions with me in the Treatment Access Bank, as well as different outreach efforts that we're doing. So we keep very close track of that. I know Turn Up Knox, they have so many different partnerships with different community organizations. So we do a lot of different quality measuring, so surveying clients, teachers who we partner with, our clients themselves, and also the percentage of the kind of demographics we serve. So like our Screen Now program, we have a really high, at least relative percentage of marginalized people that take those in comparison to kind of Knoxville's greater population, as well with my program. 80% of my program participants are people of color. So trying to make sure that we're getting these resources into different communities who are underrepresented and receiving mental health care services is our highest priority. Then also keeping track of new community resources. Knoxville has had recently newly built behavioral health care centers. So that's been really encouraging to see that there's new things coming into play all the time, and more funding getting into our communities. So we've received funding through like Knoxville's ARPA grants for COVID. And then with Turn Up Knox as well, different funding streams to keep our programs going. They're very diversified. So we're able to sustain this and continue to build momentum. Mental Health Association has plans for May's Mental Health Month. So we have a lot of different media outreach campaigns we're doing, lighting up different landmarks in Knoxville Green to spread mental health awareness, and continuing to foster those partnerships across sectors to make sure that people are getting the mental health care that they need. Thank you so much for taking the time to listen to us. We look forward to hearing from you soon.